So last week we talked about symptoms of ADHD. This week we'll talk more about the treatment. Initially, we have to rule out medical issues. We have to make sure that there's no vitamin D deficiency, zinc, thyroid issues, anemia, vitamin B12 and folate, hormone such as testosterone or progesterone deficiency. So also we have to make sure there's no history of traumatic brain injury. The second thing we look at is the diet. So diet is very important when we talk about ADHD. So the number one thing to look at is make sure you avoid processed food. Really, there is always sugar, salt, and all kinds of chemicals in the processed food, which can trigger anybody with ADHD. The other thing we talk about is elimination diet. So we make sure that you look at the sugar, corn, dairy, and corn. So usually recommend that you stop all of them and then start one at a time and see which one triggers you. And once you have identified what issues that you may have, so we recommend that you stop or at least cut down, because we know sometimes it's not easy for some people to cut down, especially when it comes to sugar, which is in every product that we have around. The third thing to look at is the exercise. How long are you exercise? At least are you getting 30 to 40 minutes? So most recommended exercise for people with ADHD is running, cycling, swimming, playing tennis, martial art, and so forth. So those are the exercises that we usually recommend for anybody with ADHD. And lastly, we will look at the medication. So not everybody with ADHD want to be on medications, especially the stimulant. So some of the supplement that we use are omega-3, and then rhodiola, magnesium threonate, Bacopa, and so forth. We can also use non-stimulant medication to help. And also, if you are required to be on stimulant, the first thing we do is to make sure we do an EKG to make sure there's no cardiac issues. So anybody with cardiac issues, we usually try to abstain from stimulant due to long-term use leading to cardiac issues. And the other therapy that can be used is neurofeedback, red therapy, and as well as sleep. We also recommend that people avoid drinking too much coffee because that can lead to insomnia. Some of the other thing that I forgot to mention is sleep apnea. So that's also one of the medical issues that we try to rule out when you have ADHD. And finally, please avoid social media once you wake up early in the morning. You are trying to avoid anything that can trigger you, anything that can trigger that brain.